On that note about the prevalence of keratoconus, I feel like I'm seeing them much more regularly than what we were taught. I know like probably 10 people personally who have keratoconus. That's a way higher number than I would have expected. What are your thoughts on that?
I remember being taught in school like 1 in 2,000 patients have keratoconus and thinking like, okay, it's not that many. Even just like the idea of when the keratoconus really sort of progressed and when it became a thing. I remember thinking, okay, it's later on in their life, late teens and, you know, sort of closer to 20 and 1 in 2,000. I remember that like being in my head. And same thing, I used to then you start seeing more and more patients, especially with a lot of the specialty sort of lens. I remember thinking like there's a lot more keratoconus out there. And we now have newer data to support that it's much more prevalent than we thought. And if you actually look at the studies that showcased or explained a lot of those numbers at 1 in 2,000, well, how they were diagnosing patients with keratoconus was actually like retinoscopy, keratometry. It was not topographers, tomographers. And so we now have the ability to catch these patients at much more subtle levels of keratoconus. There are so many keratoconus patients that are out there that are struggling but have never been diagnosed. Their vision's not perfect, but they're sort of, it's good enough. So they're not caught at the average optometry offices, they're not caught in the routine exam, they're not struggling enough to dive any deeper, but they just know my vision's not as good as my colleagues, it's not as good as my friends, as my spouse. Some of the newer data is saying that it's closer to 1 in 500. Now, and we might not ever know what the exact number is going to be. It's out there though. And I've sort of spoken to my colleagues about keratoconus. I truly believe that we need to do a better job as primary ODs to catch it, to diagnose it, because it's there, it's in our chairs.